All right, today we're diving into a really fascinating drug called Pramipexole. Now, this is a medication that can do some incredible things, like quiet the tremors of Parkinson's or calm that maddening urge from restless leg syndrome. It can literally give people back control of their own bodies. But, and this is a big but, this power comes with a hidden price, a really delicate balance that you have to respect. So let's just start with the one question that really gets to the heart of this whole story. What if the very medicine that could give you back your physical freedom could also hijack your free will? That's the tightrope we're walking today, and it's a wild one.
To really get a grip on what Pramipexole does, we first have to understand the conditions it's designed to fight. And both Parkinson's and restless leg syndrome, well, they're really a kind of battle within yourself, a fight against your own body's misfiring signals.
So let's break this down. On one hand, you've got Parkinson's disease. This is a progressive, relentless loss of motor control, and it's happening because the brain's dopamine-producing cells are literally dying off. On the other hand, you have restless leg syndrome, that absolutely maddening, uncontrollable need to move, which is also tied to a problem with how the brain is using dopamine. You see the common thread? The enemy in both of these battles is a disruption of dopamine.
Okay, so if the big problem is a lack of dopamine or dopamine not working right, how do you fix it? Well, you bring in an impersonator. And that, my friends, is exactly where Pramipexole enters the scene.
So Pramipexole is what we call a non-ergoline dopamine agonist. Whoa. Okay, let's translate that in English. A dopamine agonist is our impersonator. It mimics what dopamine does in the brain. Now that non-ergoline part, that is a huge deal. It means this drug was specifically designed to avoid the really dangerous tissue scarring side effects that came with older medications. It's just a smarter, more modern way to get the job done.
So how does this dopamine impersonator actually pull it off? How does it work? Let's dive into the neurology here and see how Pramipexole can unlock the brain and give someone back a sense of control. Here's a great way to think about it. In a healthy brain, dopamine is like a specific key that fits perfectly into these special locks, or receptors, to signal smooth, easy movement. But in conditions like Parkinson's, those keys, they're gone. The locks are empty. Pramipexole comes in and acts like a master key. It's not the original, no, but it's shaped just right to fit into those locks, turn them, and get the whole system humming again. So here's how that process actually unfolds in the brain. First, you have the problem. Dopamine is low, or it's not working right. Then, the patient takes Pramipexole. That master key makes its way to the brain and starts looking for those empty dopamine receptors, specifically the D2 and D3 types. And here's the crucial part. It binds right onto them, tricking them into firing just like real dopamine would. And just like that, those broken communication lines for motor control start working again. So far, Pramipexole sounds like a miracle drug, right? And for so many people, it truly is. But every powerful tool has a potential dark side. And this is where our story takes a very serious turn. We absolutely have to talk about the hidden price tag. Okay, I really want to pause here for a second because this part is incredibly important. The side effects we're about to go over are not just, minor annoyances. These can be genuinely life-altering, and if they show up, they require immediate medical attention. Seriously. This is probably one of the most shocking and serious risks. Because Pramipexole is stimulating the brain's reward and pleasure centers, it can sometimes completely hijack them. This can lead to what are called impulse control disorders. We're talking about powerful, undeniable urges to do things that the person would never, ever normally do. Pathological gambling, compulsive shopping, things like that. It's so important for patients and their families to get that these are not character flaws. This can be a direct chemical side effect of the medicine.
And believe it or not, the risks don't stop there. People can experience sudden sleep attacks, where they just fall asleep without any warning at all, which is, as you can imagine, incredibly dangerous if they're driving a car. Hallucinations are also a risk, particularly in older patients. And you can't just decide to stop taking it cold turkey. That can trigger a really severe and painful withdrawal syndrome. This is clearly not a drug to be trifled with.
Now, specifically for people with restless leg syndrome, there are two long-term traps to be aware of. The first one is called augmentation, and it's so paradoxical. The drug that's supposed to help can actually make the condition worse over time, with symptoms starting earlier in the day and even spreading. Then there's something called rebound, where as the medicine wears off overnight, the symptoms come roaring back, often even worse than they were before.
So, you're probably thinking, with all these incredibly serious risks, how can anyone use this drug safely? Well, it all comes down to walking a tightrope. It is a true art of precision dosage.
And you can see right here just how differently this drug is used. Look at this.
For restless leg syndrome, we're talking about tiny dosages. But for Parkinson's disease, the dose required can be 6 times higher, sometimes even more. This massive difference is exactly why the treatment has to be so carefully tailored to each person and each condition.
This brings us to the single most important rule for using this drug safely. It's called titration. A doctor will never start a patient on their final dose. The golden rule is always start low and go slow. The dose gets bumped up gradually over weeks, which gives the body time to adjust, and it dramatically cuts down the risk of those initial side effects.
Let's do a quick flyby of the drug's journey through the body. It gets absorbed really well. A key point is that the liver barely even touches it, which is good, fewer drug interactions to worry about. But here's the crucial part, elimination. It's almost all handled by the kidneys, and the takeaway here is crystal clear. If a patient has kidney problems, the dose has to be lowered, otherwise the drug will build up to dangerous levels.
And all of this brings us to our final and maybe the most important piece of the puzzle. Using a drug this powerful isn't just up to the doctor. It really requires a pact, a true partnership. So, what does this all boil down to for safety? It's really all about total honesty with your doctor. If you have kidney or heart issues, they have to know. You've got to be super careful mixing this with anything else that makes you drowsy. We're talking alcohol, certain painkillers, and it's so important to know that some antipsychotic drugs can actually work against Pramipexole, basically canceling out all its benefits.
And that leaves us with this final thought, which really says it all. Pramipexole can be a life-changing medication, no question, but its power demands respect. Success and safety aren't just in the pill itself. They're in the communication, the constant monitoring, and that informed partnership between the patient, their family, and their doctor. That teamwork, that's the ultimate key to navigating both the incredible promise and the serious peril of this powerful tool.